Hi, we're here for DFW Child Baby Day with Brandy Buss, the perinatal nurse navigator at Medical City Arlington. And today we're going to be talking about not the first, second, or third trimester, but the fourth trimester. Brandy, what is the fourth trimester anyway, and why is it important for moms to know about?
Yeah, the fourth trimester is some new lingo to me as well. And it's most commonly, or what most moms refer to as the postpartum period. It is the 12 weeks immediately following your delivery of your baby. It's a super important period that we are definitely trying to educate moms and physicians to not forget about this period and almost treat it just like one of the other three trimesters that you were going through during your pregnancy.
So how often is it recommended that you see your doctor after giving birth?
So it's recommended that you follow up in 3 weeks after your delivery, and then there's a 12-week visit after that. That's really subjective. I think some doctors might do that differently, so definitely check with your physician.
Well, speaking of the physical symptoms, what are the primary physical symptoms or conditions that moms should be watching out for after they give birth?
I think just making sure, anything that you might see as a sign or symptom of infection is always a big one. You know your body best. And so if you feel that something off, definitely make sure that you check in with your provider. And depending on the severity of your symptoms, make sure that you are getting prompt medical attention. And if it's more emergent, call 911. But some of those signs that you might be looking for an infection, a fever over 100.4 degrees, if there's any oozing from, either your perineum or your surgical incision, any extra discharge that might be foul smelling or bright red after the third day after delivery might, need some attention. If you have really bad headaches, blurred vision, trouble breathing, any of those signs that you would typically be looking for that something is off, and definitely make sure that you are contacting your provider, or if it's more urgent, that you do call 911 and get some help for that.
What about mentally or emotionally? How should they expect to feel?
Overwhelmed, tired. I get that a lot. I think one important thing to remember when you're a new mom is you are not alone. A lot of moms will feel is, what we call the baby blues. And that could just be, you're tired, you might be a little bit more weepy or crying, emotional. All of those things are typical after you do deliver. And they should be resolving after about 2 weeks. If you see any more advanced signs, anything getting worse, some of those signs lasting longer, or if you feel at any time that you might want to hurt yourself or your baby, those are signs that something else is going on other than the baby blues, or it might be going into more of what we would call an advanced postpartum depression. And definitely want you to know that that's nothing that you did wrong. There's a lot of emotions going on after you deliver a baby. And definitely get with your doctor or seek that emergency attention and get some help, because there's a lot of interventions that can help you feel back to normal and help you to bond with your baby.
What about, I know moms might have these expectations about, losing that baby weight or being intimate with their partner again. What are some realistic expectations that they can have?
Be kind to your body. It takes all that time to get your body to be able to get ready to birth that baby. And it's going to take at least that time, or sometimes even longer, to get that weight off. As far as, intimacy, you're going to be exhausted. You're going to be overwhelmed. You have this new baby, and a lot of moms have other babies and siblings that they are trying to take care of. So it's just super important that you try not to be embarrassed. Communicate this with your physician and let them help you make a plan so that you can get back to feeling normal, both physically, emotionally, and intimacy-wise.
And what else is there anything else that moms can do to prepare for the fourth trimester, but before it gets there?
I think really just making sure that you are taking good care of yourself and being mindful of that fourth trimester period. And it's just so important now, the more that we are learning, that we just fully recognize this as that fourth trimester. And I think now that we are educating moms more on it, just being more mindful that it's coming, that you might feel off, that you might need some extra attention and ongoing care, is one of the best things that you can do.
Well, thank you so much, Brandy, and thank you to the entire Medical City Healthcare team for helping make Baby Day happen. Appreciate it.
You're very welcome. Thank you for having me.